In Stockholm in September of 2015, there had been an announcement that for the very first time, there was actually a cardiovascular benefit with one of the SGLT2 inhibitors. Remember, this comes on top of 3 trials, DPP-4 inhibitors, that had shown that they met their primary endpoint for safety but did not show any cardiovascular benefit. And so in Stockholm on a Thursday night, it was like a rock concert, people trying to get in this room. No one knew the data except, of course, the investigators themselves. And when they first got to the stage and presented the trial, they then got to the results, and they showed a 13% reduction in 3-point MACE. That's M-A-C-E, major adverse cardiovascular events. Everybody politely clapped. Good, they met their primary endpoint. The next thing they showed was the cumulative plot of cardiovascular death that showed a 38% reduction in cardiovascular death in the EMPA-treated group. People were stunned. That's an absolute risk reduction of 2.2%. In a cardiovascular outcome trial, that is enormous. And that was the first trial that let us know that the SGLT2 inhibitor empagliflozin had really positive cardiovascular benefits. The other thing that was interesting is these curves did not take a year to separate. These curves separated immediately and were statistically significant within 50 days of the onset of giving empagliflozin to that one group. In addition, things that did not go into the empagliflozin label that has since come about from the FDA, 35% reduction in admission for heart failure. You know, so this was a game changer. I mean, this was a real game changer, and that's why empagliflozin is the first drug in the United States that got the FDA approval for reduction of cardiovascular death, in addition to indicated for type 2 diabetes for glycemic lowering. This EMPA-REG trial design was designed to try to not focus on glucose lowering. So by the end of the trial, the differences in A1C were maybe 0.4%. The differences in systolic blood pressure, 3 or 4 millimeters of mercury, clearly 2 points that did not drive this cardiovascular outcome. And they combined both the 10 and the 25 milligram dose of empagliflozin in this to get their results. The other interesting thing that there was actually a reduction in progression to renal events. So some 40+% reduction in renal events, which is why you're seeing a lot of now chronic kidney disease and renal trials being done, which will probably in the next couple of years give us even more information about whether there's renal protection in these medicines.